Welcome to this week's edition of Focus on Connecticut. I'm Tom Appleby. Our guest this week is a familiar face to many of you because she was the first select woman of Darien for 3 terms, and she is now the Commissioner of the Department of Housing in Connecticut. Evonne Klein, thank you for joining us.
Well, thank you for having me today.
I didn't realize, while I studied up for this, that you were the first commissioner, that this department didn't exist until, well, you said 3 years in July, like 2013. What did we do before that?
Well, the Department of Housing and the housing building and services were in a number of different state agencies. I call them the bricks and mortar programs, and the funding to create affordable housing was in the Department of Economic and Community Development for about 30 years. And the programs, the support programs for individuals and families who may be experiencing a housing crisis, along with our Section 8 vouchers that we have in the state and our rental assistant program certificates, were in the Department of Social Services. And there were some other programs that were in the Office of Policy and Management. So as I think many of us are familiar, that housing is an important priority for Governor Malloy, as it was for him as mayor of Stamford. He carried that forward in his administration. So he wanted to create a Department of Housing so that we can bring all the housing programs together under one roof, so to speak, and so that we can more effectively and efficiently address the housing issues that we have in the state of Connecticut. So in my department, we have a number of funding programs to build affordable housing, and we have a number of support programs within the department to help folks who need affordable housing. And we have other services that would support housing authorities, data collection, and so on. So this has worked incredibly well, because we've been able to achieve so much as a department in less than 3 years as a department. We now have, as I had mentioned, our support services are now within the department. So when we are looking at assisting developers and municipalities to build affordable housing, we talk about the support, the rental supports that we have, and do we have them, and can we support developments with them to make them more financially sustainable. So it's created greater collaboration within our housing folks in the state, within our federal partners and our local partners. Folks know where to come. There's more predictability in terms of funding for municipalities and developers to build affordable housing because of the way we have organized the department. And some of us remember a time, and it was about 30 years ago, there was a separate Department of Housing, and as I said, and then for 30 years it was combined in DECD and other departments within the state. But also we have about 3 gubernatorial administrations where no state funding was made in affordable housing across the state, and we had to really rely on federal funding to build that affordable housing across the state.
So just to be, this is really all about affordable housing. It's
yes.
You're not like those twins who take couples around and look at 3 houses and decide how you're going to spend your $800,000.
No, that's not the business I'm in. Our goal here is to create housing across the state of Connecticut that is affordable for folks at all income levels. And what we do build are mixed income, mixed use developments, which are really add a vibrancy to communities across the state.
And yet, we see in communities, particularly in southwestern Connecticut, which is the area we cover, a reluctance to have affordable housing built in their bailiwick.
Yes, there does seem to be a reluctance, but I think that's actually disappearing as we work with municipalities across the state and within the southwestern region of the state. I think municipal leaders are understanding that a wide range of housing options within their communities allows for the growth of a more vibrant community. And think about the businesses that have cropped up along main streets throughout the whole southwestern region of the state as we see downtown downtowns being redeveloped. There are opportunities for folks to live and work in the same communities. We see mixed income developments cropping up. We also see mixed use developments cropping up. You see more apartments being built in the downtown areas of municipalities across southwestern Connecticut, and that's all good news. What we know, and living here in this part of the state, I-95 is incredibly crowded. Getting to work is challenging, and if you're working in a service industry in Fairfield, say, and you have to live an hour away, it's a challenge for you to get to work. Now, folks, when you have affordable housing options, folks can live in the communities in which they work.
We're going to take a break. When we come back, let's talk about some of the specifics of the homeless issue. Sure. Just a moment. Stick with us. Welcome back. We're talking with Evonne Klein, Commissioner of the Department of Housing. You've had some big successes, and I didn't realize this from a challenge, the Mayor's Challenge. It sounds like a yacht race or something.
Well, yes, the Mayor's Challenge, that was a challenge led essentially by First Lady Michelle Obama to all mayors in the country to end veteran homelessness by the end of 2015. So Governor Malloy was I'm proud to say, he was one of 4 governors to take on the Mayor's Challenge. And at the end of 2015, Connecticut effectively ended veterans homelessness.
It was recognized by the federal government.
It was.
Having done so.
Yes, and that is, you do need to get a federal designation that you've ended veteran homelessness. So in August of 2015, we were the first state in the nation to end chronic homelessness for veterans, and then at the end of 2015 in December, we received the designation that we were the second state in the nation to end veteran homelessness. And we say we've effectively ended veteran homelessness. And what that means is that in the state of Connecticut, we have a unique collaboration of folks on the federal, state, and local level who have come together to create a system where we quickly identify homeless veterans and place them into interim housing if necessary, and then into permanent housing in 90 days or less. Stop you
at the very beginning of this. How do you identify someone as a homeless veteran?
Well, we've changed how we do business. In the past, we have not worked together as providers and as agencies. So we came together to pull all of our resources together and say, how can we do a better job of identifying homeless veterans? So we now do much better outreach and referrals. We've updated our homeless management information system where we identify veterans. Something as simple as asking, are you a veteran? Veterans were very reluctant, homeless veterans were very reluctant to identify themselves as veterans. So we've gotten folks to identify themselves. We've done much better outreach. We've given veterans appropriate referrals so they get the necessary benefits and supports that they are entitled to. And we have, as I had mentioned, a greater coordination of support services. And in Connecticut, we are a housing-first state. And what we believe and what we know works is that when a homeless individual is placed into permanent housing, they have a greater chance of success than if we ask them, in the old days, we used to ask folks, well, you got to go get sober first. You need to get a job first. It's awfully hard. Or you need to stay on your meds first. But it's awfully hard to do that when you don't have a home to get a job, to write a simple, fill out the job application, this is my address, or simply to have those support services around you in a homeless shelter for you to continue to stay on your medications and stay on your
So program. That's where housing first means. Someone in a home, in an apartment, first. And then you focus on the other. Now, do you focus on those other aspects of their lives?
We pull together community providers who do so. So that's why this collaborative is so important for folks who are homeless. And we're just breaking down silos and learning that's how things are more successful, how whatever it is that we're involved with becomes more successful. So we're having great success with our homeless population, keeping them housed and getting them on a path. We have great stories to tell where folks are in a home, keeping their jobs, are with their children. Some folks have had unfortunately their children taken away, and now they're reunited and they're able to put down roots in a community and lead successful and productive lives.
In this period of belt tightening that we're all experiencing, I imagine there are people out there saying this is all wonderful and I'm glad people, but are you telling me that I am housing people on my tax dollar?
Well, yes. And certainly in an area of belt tightening, what we know is when someone is homeless, it is more expensive to have someone stay in a state of homelessness than in a permanent home. When someone is homeless, they're cycling in and out of expensive systems, in and out of the emergency room, they may be in and out of prison, so they're not productive members of society. Now we're actually getting folks into a home who can be employed, who can put down roots and be a part of a productive society, and we're not paying for those high public systems that they cycle in and out of.
This is the focus on veterans, but there are plenty of people who aren't veterans who are in need. When we come back, let's talk about that aspect of the problem. Back in just a moment. Welcome back to Focus on Connecticut. I'm Tom Appleby. We're talking with Evonne Klein, who is the Commissioner of the Connecticut's Department of Housing, former Darien First Select Woman. Why did we start with veteran homelessness as opposed to general homelessness?
Well, I always like to say, well, why not? These are folks who went and served our country, and they're coming back and facing challenges, and one of them is homelessness. So it's who else but to start with but our veterans. So we've been, very successful in this effort. We had 1,000 veterans who presented as being homeless, and we housed 766 veterans into permanent housing. And many of those other veterans, you could say, well, where did they go? Some wound up in a hospital or with family. Some, unfortunately, did go to prison, and some were in nursing homes. So we've had great success, but this is a population that certainly deserves, I think the First Lady said something, these are folks who come home and they kiss the ground when they come back home, and they shouldn't have to sleep on the ground. So why not our veterans?
The governor says that we're at an all-time low in homelessness in Connecticut in general, but we're not there yet, and that's the next priority. Our next
priority is we started with the veterans, and our goal for 2016 is an initiative called Zero 2016. So our goal is to focus on ending chronic homelessness by the end of this calendar year. And a chronically homeless individual is someone who has a disability, who has been homeless, pretty much what you would think of a chronically homeless individual, who's been homeless a year, 12 months or longer, or over a period of time they've been homeless for a total of 12 months. So we, through our efforts in improving our data system, we've been able to identify our chronically homeless individuals within the state of Connecticut. We have over 1,000 individuals who are chronically homeless, and we are well on our way to meeting our goal by the end of this calendar year.
And is there a range of issues for these homeless? Some we know have mental issues. They are never going to be able to fully function. And then there are some who find themselves suddenly in need, and they were functioning members of society.
Well, chronically homeless individuals are very different from someone who has episodic homelessness. So a chronically homeless individual is someone who has challenges of some kind, whether it's a form of addiction, whether it's mental illness, and those are the folks who need support services around them. There are some people who will find themselves in a housing crisis or homeless for a variety of reasons. They've lost their jobs and there was an illness and you just things just keep happening. Those are folks who we can help quickly with minimal support, so will be back on their feet, back at work a little quicker than someone who has been chronically homeless.
I would imagine shelters are a source for you of the kinds of people who need your help.
Well, homeless shelters are where, as we know, folks go, and this is important in the change that we have made in addressing homelessness in the state. A couple of years ago, and it's really a matter of a couple of years ago, where folks would enter a shelter and people would shelter surf. Where's the bed? Where's my bed for tonight? What we're doing in the state of Connecticut is that we're working, rather than managing homelessness, we're working with individuals to get them permanently housed. And how does that work? We do ask folks to call 211 and speak to a housing counselor. And then we now do intakes so that we can help folks get on the path to permanent housing. In the past, that didn't happen. As I said, we were just managing homeless. Now we're actually helping people exit homelessness, helping them get a permanent home. And this system, it's called a coordinated access network. We have 8 across the state of Connecticut where all of our providers have come together to help folks not stay in shelters, but to move them out of shelter into permanent housing as quickly as possible. And this system is working. We've had some bumps in the road, but it's working. What we see is that when our networks meet together, they're having real success in the numbers of folks that they're housing every month.
We're going to take one more break, and when we come back, let's move back to that subject of affordable housing for a much larger population than just the homeless. We'll do it right after this. Just a few minutes left with the Commissioner of Housing. When I talk to people about southwestern Connecticut, when we have people visit News 12 Connecticut as a possible place to work, from other places in the country, we always say it's an eye-opener. Living here is very different from living in most places in America. And housing is one of the key issues. It's so expensive. So when we say affordable housing, to many, that would be decent housing.
Well,
affordable housing is decent, but that would be upscale housing.
Right. So our goal in the department is to build affordable housing across the state of Connecticut and clearly in southwestern Connecticut. During the past, I will tell you, since 2011, since the governor has been in office, we have created or rehabilitated or funded 16,000 units of affordable housing across the state. And since 2015, we have done 11,000 units. So our department has really been doing the job it's been charged to do. Again, not having a range of housing options within municipalities is very limiting to a municipality to function, to serve their folks, to have a workforce, to become economically viable. And, that's certainly, you could say, well, that's not a challenge in Fairfield County, but we have so many businesses here who rely on a workforce. And this is an opportunity for those folks to live here and not have to get on I-95 to try and get to work.
And municipalities, particularly the more upscale, are often reluctant to make room for affordable housing. Is there any kind of leverage?
Every municipality, well, what we know is that in each municipality there are folks who need affordable housing. So many people are paying more than 30% of their income on housing, and that is just so stressful for a household. And it doesn't matter where I go, whether it's here in southwestern Fairfield County or any other upscale community across the state, I run into folks who tell me that it's just too hard for them to live in this community, the community in which they are, and they're just trying to hang on to live there, whether it's for their children or because they've established themselves in their community. So what we know is that in each municipality there is a need for affordable housing at all income levels.
And yet, those communities, which for many years were quite happy to take the tax dollars from those people who are now on perhaps fixed incomes, they're elderly, are not moving forward in many cases.
Well, in most cases they are. I do have to say that there is a renewed interest in housing options in the state, because I think municipal leaders are understanding they need to retain their senior population, seniors who have lived in the municipality for 60 years don't want to leave, and they can't have that 4-bedroom house anymore. And municipalities also realize they're losing their young folks. And how do we get young professionals back? Because they need an affordable place to live. So folks making $50,000 a year or $80,000 a year or even $40,000 a year, how do we keep those folks in our communities, in some cases attract them to our communities? And there are families who are struggling because their parents want to ensure that the children have a great education, but they're not able to pay for health insurance, doctor's visits, dental visits, because they're paying so much on a mortgage or rent to be in that municipality. So clearly, and as I've addressed the workforce issue, clearly to have a vibrant municipality, it certainly, I have to say, it pays for a municipality to have a wide range of housing options to make that municipality more vibrant.
I know that's high on your list and the governor's list, and we'll keep following it, and hope you'll come back and tell us how the progress is going.
I will.
Thank you, Evonne Klein, for coming by. And thank you for joining us. Stay tuned. The news continues.